Brent Varnadoe, welcome to the Business of Innovation podcast.
Thank you so much. I'm glad to be here.
I'm particularly pleased to sit with you because you actually are an MBA student who is in our entrepreneurial program, and you are a physician. We've had other physicians in our program, but this is the first chance I've really had to be able to really learn more about why a physician would choose to go back and get an MBA. And I'd kind of like to hear from you on why you chose this program and what you plan to do with it.
Sure. So the reason I chose this program is when I was initially thinking about a career change about a year ago, I went to the chair of medicine over at Prisma Health, where I work at now, and kind of started picking his brain about what other options there are outside of just straight clinical medicine for physicians to do. And he kind of told me, you're a great doctor, I'm paraphrasing, but you probably don't have any formal business training, do you? And I said, no, absolutely not. And he goes, well, it's probably going to be difficult for you to do any sort of administrative role without some way to improve your leadership skills, your management skills, know how to read a financial statement, that type of thing, because these departments are large. A lot of money goes through them. So I started evaluating programs, and I noticed right off the bat there were several choices between MBA programs, Masters of Medical Management, Masters of Healthcare Administration, a lot of things that were specifically geared towards healthcare. And while that was very appealing, what I didn't want to do was pigeonhole myself into just working for a hospital system or a healthcare company. So I picked an MBA program specifically because the broadness of the education would allow me to work in pharmaceuticals, insurance, medical device companies, consulting like Deloitte or McKinsey, something like that, as well as the healthcare system, because you do see MDs with MBAs within the healthcare system. Now the specifics of why I chose Clemson were the Innovation and Entrepreneurship Program specifically, because I wanted the broad base in the financial training, the management and leadership, but also learn how to both start my own business if I wanted to down the line, and also to start a business within a business, if that makes sense. So those were the things that really appealed to me about the program.
Absolutely. Has anything surprised you so far about the program, or anything in particular that you...
Everything, really.
Really?
Yeah, everything, really. It was completely different than what I expected. Now, I knew what the schedule was going to be a lot different than what I remember from college and medical school, weekly classes and all that stuff. But the depth of the information, the high value, I was expecting it, but it was really surprised me how high value I really found it to be. I've spoken with some folks recently who've gotten MBA programs from Kellogg, from Duke, and from Arizona State, and I was going over the things that we were doing, and they were very impressed with the stuff that we were going over. So it was that was probably the biggest surprise to me. Not that I wasn't expecting it to be good, but as good as it is was really been a nice surprise.
Wonderful. Anything in particular you would want to share? Especially for those who might be listening and thinking about how should I be more entrepreneurial, or what should I be thinking about?
Honestly, the biggest thing I found was to don't be afraid to go to people and express your ideas. You may have a great idea, but unless you get it out there and somebody hears about it, it's not going to happen. And in fact, recently I had the opportunity to sit down with our chief clinical officer and talk about, I don't know if you remember my hospital at home idea and a couple other things I talked about in your classes about the social determinants of health. And unbeknownst to me, the hospital system had already started doing some of those things, and I was actually offered a chance to get involved. Now, because I'm leaving the hospital system, I'm not going to do that. But if I hadn't gone to him and said those things, that opportunity may never have presented itself. So that would be the big thing. Go to people, talk to them. They're not going to just shut you down.
And what I'm hearing you say there is organizations, hospitals, other businesses, they're looking for innovative solutions.
Absolutely.
They're looking for people that are thinking out of the box and wanting to do different things.
100%. And the fact is, when you go to folks and they're already doing that kind of thing, that's not a bad thing. Just because you didn't think of it first doesn't mean you can't help.
Excellent. And you just alluded to the fact that you are going to be leaving your current employer, and there's something else on the horizon. Can you talk a little bit about that?
Yeah, let me kind of go through my role first at Prisma Health,
Please.
And then I'll tell you kind of where I'm headed in a month or two. Kind of wear a couple of hats within the hospital system right now. I'm in the hospitalist group, which is under the internal medicine department. I'm the lead hospitalist for the subacute rehab department. It's a very small department, so don't let the title fool you. But what we do is staff some facilities, subacute rehab facilities that are outside the health system. Our goal is to kind of reduce hospital readmissions, unnecessary ER visits, resource utilization, that type of thing. Over the past several years, we've consistently beat the national average percentage-wise for readmissions and ER visits, as well as decreasing costs and increasing the patient complexity that these places are able to handle. The second role that I have within the system is I'm on the faculty at the medical school, an assistant professor of clinical internal medicine, which is just a fancy way of saying I teach medical students occasionally. We have them rotate out there during their geriatrics rotation, and that actually I get a lot of satisfaction out of that. I don't teach as much as I used to, simply because I'm not in Prisma Health facilities as much anymore, but that's still a lot of fun. However, coming up in January, I'm going to be finishing up at Prisma and moving to become a reviewing medical director with Humana, one of the larger insurance companies. Go ahead.
And just not to take away from that, but I'm just curious for one moment. So back to the hospitalist concept, and I know that OBs do that, and I guess now internists do that, but I guess having those specialties in the ER, then you can address things more quickly. Is that how you get the numbers better?
Yeah,
or?
so what we're doing is they're sending us out to facilities that typically have minimal physician coverage.
Okay.
But we're there every day. So that means we're able to catch problems before they become serious. Hopefully, at least that's the goal. So a urinary tract infection or a pneumonia that can typically be treated with oral antibiotics, if nobody sees that patient for several days, they get sicker and sicker and sicker. They end up in the emergency department, end up in the hospital. We're able to catch those things earlier, treat them appropriately in the facility that they're in, saving everybody a lot of money. The facility loves it because the patients stay there. They don't have to be transported by EMS to the hospital. The hospital loves it because they don't want those patients they just sent to that facility to bounce back. So that's kind of how the program works.
Okay, just curious.
No, that's fine.
Sounds like you have some pretty good numbers and results from the work that you've done.
We do.
Which certainly will be potentially informing even thoughts and things that you might do in your new role. So talk a little bit more about that new role.
So what we'll be doing there is the United States is divided up into 16 regions for Medicare by the Center for Medicare and Medicaid Services, part of the federal government. And so I'll be one of the medical directors for the Southeast region. And so what we'll do is review all the Medicare admissions that Humana has for appropriateness. And the reason I chose this position is I wanted to get a little bit more exposure to kind of what people call the business side of medicine. I've been in clinical practice for 15 years. I feel like I'm pretty good at it. But that's a very small slice of what medicine in America is today. So I'm trying to get a little bit more exposure to how payers evaluate care, why they do the things that they do. And the reason I want to do this is down the line, I'd like to have a larger impact across populations instead of individual patients. Not that you can't have a great impact on individuals. I'm not saying that at all.
Right.
But the decisions I make on a day-to-day basis, it may affect, the 15 or 20 people I see that day. Whereas the decisions that are made in large organizations like Humana, like medical device companies, like pharmaceutical companies, the higher-ups in the administrative side of healthcare companies, they affect thousands and tens of thousands of patients a day that are seen throughout the system. So that's kind of where I would like to go.
Sure, absolutely. Have you, what do you feel like has been your biggest challenge as a physician?
Recently, over the past 6 or 7 years, the advent of electronic medical records has made, I hate to say, the day-to-day practice of medicine a drudgery, but it has made it much less fun than it used to be. I understand completely why it's been instituted and why it's a rule to use them. In fact, I agree with it 100%, but that just means that 10 years ago, 75% of my time was spent seeing patients, 25 was documentation. Now it's reversed. So 75% of the day is spent in front of a computer, which I don't mind necessarily. It's just I've not found an electronic medical record yet that is very user-friendly, and that makes it day-to-day just very difficult.
And what have you found to be most gratifying as a physician?
Direct patient care. Not so much the chronic medical issues, but the acute stuff that we're able to find and fix. People are incredibly grateful for that. And you have a defined problem that you can go in and fix and make somebody's life that much better very quickly, very easily. That's very satisfying. And that is honestly something that I will miss.
You talk about this coming into the program, really, getting some validation about how innovation can work and trying new ideas. And, we know with innovation sometimes comes failure, that kind of thing. How will you think about innovation going forward? How do you think about innovation in the medical field?
There's a lot that's coming down the pike, whether it be single payer or a blended system like, for instance, like Germany has, or the status quo that we have now. Medical devices, pharmaceuticals, care at home, things where people are not necessarily admitted to the hospital with medical problems if they can be cared for at home. And you don't want to change just for change's sake. That's not innovation to me. There's got to be an improvement, whether it be a process or procedure, an outcome in some measurable way. So it's difficult to define one single thing as how I'm going to think about innovation in healthcare when there's so many changes coming around the bend. You really just have to be open to everything. Some of the things that were commonplace 50 years ago, home visits, are coming back around, which I think is great.
Yeah.
In fact, I'd love to be able to do that occasionally.
Would you really?
I really would. I think it would be really cool to be able to show up like Marcus Welby at somebody's house and take care of them. And I'm sure they would love it as well. But those kind of things where they sound innovative, a lot of times they're things that have been done forever, but they just fell by the wayside for various reasons, and now they're coming back. Yeah.
Absolutely. I mean, nothing is completely brand new. It's
Right.
always revisiting
Right.
things
Right.
and combining things. My dad he receives his medical care at home because he was a veteran, and the VA has really expanded their offerings and their ways of being, but his nurse practitioner, his physician, they all come to see him at home.
I bet he loves it.
He absolutely loves it, and our family does too. It's made life so much better for him.
Absolutely.
So I did think about you when I realized that was available to him, and so I think that's. I guess it makes me wonder. Do you consider yourself a disruptor?
I'd like to think so, but I haven't had that many opportunities because it's been so. The type of medical care that I've been involved in, it's very regimented. You have a defined amount of time, defined amount of patients you have to see in a defined way. Your documentation has to be just so. However, the chances that I've had to come up with things, whether it be staffing models or coming into new facilities, it's an opportunity to kind of display your innovation chops, if you will. And it's been received fairly well, and it's actually worked fairly well for the most part. And I'm hoping that going forward, I'll get some chances to maybe implement some of the ideas I've got bouncing around.
And if I haven't said it already, congratulations on that new position.
Thank you.
I mean, it really sounds like it was you ramped up for it, and getting the MBA, it's maybe very good timing
Absolutely.
as you move into this new position, and actually will be able to have a laboratory where you can maybe
Absolutely.
apply some of these new things.
And I'll say during every interview that I had, and there were an extensive amount of interviews for the position, the MBA program was one of the first things they brought up. Well, what are you going to do with that? All that kind of stuff. They were very impressed that we were doing that.
Excellent. Glad to hear that. I want to ask you for young people out there who might be listening to this podcast, how did you know you wanted to be a physician? When did that start for you? And
honestly, when I was a child, I remember back 3rd, 4th, 5th grade when people would ask what I wanted to do. Now, you always, fireman, police officer, all that kind of stuff, but it was consistently that I wanted to be a physician. Part of it was I had parents of friends who were doctors, and they always told the best stories about things that had happened.
yeah.
And it always just fascinated me. And so since I was a little child, now there were occasional forays into other things as people get interested and you find out about new things. But it's been a consistent thing since I was at least 9 or 10 years old.
Wow.
Yeah.
And as you look at this new experience that you're getting ready to have, how are you preparing yourself going in? Are you researching? How are you going to prepare yourself for taking the position?
Talking to folks who are doing it now. The there's 8 of us that are in this region, the Southeast region for Humana. I think 2 of them are in Atlanta, one's in Boston, one's in San Diego, one's in Fort Worth, one's in Denver. I may be leaving somebody out. I think that's 8. But they have been incredibly helpful, allowing me to pick their brains as far as, do I need to do certain things? And there are certain things I can't say because of privacy issues, but they have been incredibly helpful in a preparatory sense. And actually the direct conversations have been the best preparation. I think I'll let you know in a month or two once I've started whether it actually did prepare me. But I think that's been the best preparation that I could do. There's not anything that I can do to read or practice, if you will, because it's all protected health information. I can't look at it before I start the position. But the direct conversations has been the best preparation, I think.
It sounds like everything you've done in your career, everything you've probably done in your schooling and perhaps even in your life has uniquely prepared you for right now. Do you feel like that might be the case?
It's very strange, but when you say that, it's because even this position that I'm in now is what in the realm they call post-acute care, after the hospital but before they go home kind of thing. That's one of the huge parts of the business that I'll be going into. So it does seem like every little bit plays a role in having prepared me to be in this next role. So it is strange now that I think about it, how that has worked out.
Yeah, I think that's kind of a cool feeling when it seems like it's kind of coming together. And I'm curious to know, as you step into this new role, as you think of yourself as a leader, what is one thing you really kind of like about yourself as a leader, and maybe what is one thing maybe you don't like as much about yourself?
It's actually on the same spectrum. So before I started the program, we had what I'll term a professional failure. We had, back in early 2018, we were tasked with taking over a facility. It was the first facility. We had been in one facility for 5 or 6 years, and we were going to expand our program into a second one. And
a facility just means the building it's in?
A building out that's not owned by Prisma Health that we were going to care for their subset of patients.
Okay.
And I'll take full responsibility. We didn't prep for it appropriately. I won't give you the names for privacy reasons, but it was an administrative failure on our fault. It was a leadership and management failure on our part. We didn't prep the folks on their administrative side with what we needed. We didn't tell them our expectations. We didn't get their expectations. And when things went badly, I handled it poorly. And so when that happened, we had to eventually pull out of the facility 6 months later. And I still feel that's one of the biggest letdowns for our group that we've had. Now, since then, we've been in 2 other facilities that have gone incredibly well because of the lessons we learned there.
Yeah.
I learned more from that screw up, if you will, than anything else we did. So the next time we were told by the administration at Prisma, hey, we need you to go in here, we went to the administrative side of things on their end, and very clearly, very concisely set our expectations, asked for theirs, got everything set up ahead of time. And that has been incredibly satisfying to watch unfold. The other part of that, I'll say, is when you say, what is something I like about myself, that failure has taught me what I need to change as a leader and a manager, because I handled that very poorly. And I've used some of the lessons from your class actually over the summer to repair some of those relationships that got damaged, and now they're stronger than they were even prior. So it's gone really, really well.
So you were able to kind of mend or kind of repair those.
Yeah, I was able to repair the damage that I did and actually come out stronger on the the other side.
Yeah, I was going to say, just the humility of doing that, I'm sure.
And that's part of being humble about it and saying, hey, this was my fault.
Yeah.
How can I fix it? How can I help you fix what's going on? Their mouths dropped.
Yes.
And it's since then, now the back and forth and problem solving is so much easier because we're open with each other.
That's so great. I appreciate you sharing that.
Absolutely.
Because sometimes it's hard to do that and to
it's
say that.
Incredibly difficult.
So you're modeling that for them, then certainly makes it easier for them to say it.
It's an ongoing struggle for me because that's not who I am, but I am learning. So, but it's been seeing the change in folks' attitude day to day, long term, and just the happiness level that's going like this.
Wow.
That's what keeps it going. Because if it didn't work, you'd be like, this is kind of not working. But you took the chance and it worked really well.
I heard vulnerability and humility.
Yeah. I wasn't going to say the word, but that's exactly what it was.
Well, that's a great story.
Yeah.
So, what are you curious about now? I mean, personally, or what are you curious about? I mean, you obviously love learning.
Yeah. It's going back to something I said earlier. The changes in healthcare are that's what I read about when I get. It's weird. I know. I look up articles on healthcare when I get off of work, and people are like, "What are you doing?" I'm like, "Well, this is kind of what I'm interested in for obvious reasons, but I want to know what's going to happen with everything, and that means, are we going to single payer, or how is the healthcare system going to change? What new pharmaceuticals are going to be introduced? What medical devices are going to be coming down the pike? How are we going to pay for all this?" It's really fascinating, and there's some really interesting ideas out there. That's what lights my fire. That's what really, my wife, it drives her nuts, and I'm in bed with my iPhone reading at 10:30 at night, and she can see the glow, and she's like, "What are you doing?" I'm like, looking up this new device that's coming out, kind of thing.
Yeah.
So that's what really interests me.
It's definitely your passion.
Yeah, absolutely.
It's huge.
Absolutely.
What do you think about, just to be a little bit random here, but like blue zones, those areas of the world where people live longer and they're healthier? There's a blue zone, different places, but people are healthier. They're part of communities, and where they go in and create a blue zone now, because they're trying to, simulate those, they actually, restaurants get involved, they have a blue zone menu, and communities are involved. And there's certain things that they, so maybe we can have that discussion in the future, but it is a more holistic way of being, that's beyond just the healthcare.
Yeah,
part.
that's one of the big things. Also, I should have mentioned that when you asked what I was interested in. It's kind of a term that's a little bit played out, but the social determinants of health is basically the concept that your environment, where you grow up, where you work, where you live, where you play, your socioeconomic status, your access to clean water, a safe shelter, a safe environment, all of that impacts your health, not just your access to medicine or your ability to get back and forth to your doctor. Those things are important, but all those other things shape your overall health, or your well-being, your wellness, if you will. And it's interesting because some of the larger healthcare systems in the United States, your Intermountains, your Geisingers, your Kaiser Permanentes, are getting involved in affordable housing and elimination of food deserts.
Interesting.
And
Yes.
showing people how to cook and prepare food. Taking people to the grocery store, hey, this is healthy, this is not healthy. Showing people how to shop. That's basic stuff that keep them from getting unhealthy in the first place. And that's prevention is way better than trying to fix a problem on the back end.
Absolutely.
And they're also starting to understand that those little steps can save them a ton of money, because a lot of it does go back to cost. It has to. I mean, you can't pay for everything for everybody, unfortunately. So they're trying to figure out ways to prevent some of these bad things from happening. If you can get people in safe, affordable housing, if you can get them food that is healthy and allow them to prepare it in simple ways that are easy to do, you've cured a lot of problems down the line. So I think those wellness things, not just medical things, are where kind of the future of healthcare is going to some extent.
And do you see in your new role there may be ways for you to become involved in those kinds of things?
That's what I would eventually like to do.
Yeah.
This role, not specifically, but I think the exposure to the business side of medicine and understanding how payers work will allow me down the line to get involved in those things, to try and help do those things that I'm really, really interested in.
Best advice you ever received?
Don't make any decision that won't allow you to sleep that night. And I don't remember, and I've been racking my brain to try to remember where I heard that. It may have been a random anecdote. It may have been somebody who told me that. I don't remember. But there have been times where I've, you kind of go back and revisit that decision. Did I do the right thing? Did I do the right thing? And if you realize that it's going to keep you up at night, you probably ought to go back and address it, because that little voice in your head or your gut or whatever you want to call it, a lot of times is right.
Yeah.
So that's been kind of the best advice or the best thing that I've read that I really try to incorporate.
No, it's great advice. Absolutely great advice. How do you want to be remembered?
Two things. I'd really love to be remembered as someone who has integrity and someone who is kind. I think those are probably the foundations of almost any relationship, whether it's business or interpersonal or whatever. I'm still working on those. I mean, I would love to say that I have kindness. I am really working on it. I do feel like I have a bit of integrity, but it's an ongoing struggle to. I have a temper, unfortunately, but my wife would back that up 100%. But as I get older, I mellow out a little bit, so it's becoming easier. I'd also love to be remembered as funny, but I'm just not sure that's going to happen. But we'll see.
I wanted to ask you also if you had any advice for anyone going for their MBA, and in particular the MBAe program, of which you're a part of. What advice would you have for them starting out in that program? Coming in the door, what would you tell them?
Embrace the information you're being provided. It's you will think that it's way different than any class you've ever taken when you first step through the door, and it is, because they're trying to get you to see the world in a slightly different way. It's not the MBA of the 1980s presented in movies where it's just straight business, financial stuff. You'll get plenty of that, don't worry. But they're really trying to mold you as a leader, as a person who relates to others, because without those skills, nothing that you want to do will ever get accomplished. If you can't get people to buy into your vision or what you're doing, can't get them to do what you need them to do, what you want them to do for the betterment of your team, none of it's going to work. So embrace the vision that they have for you, because it's really going to work.
So you saw that in your program, and did it take a minute to kind of figure out, hey, what's going on here?
It did. It did. We were all kind of, and it wasn't just me. It was, but you looking around, and go, this is really different than any class I've ever taken. But then when you get done, particularly after the first residency weekend, we all went out and we were like, this is really some amazing stuff. So it was one of those things where it was very eye-opening, but in a good way, and in a way that you found to be high value.
Good. I'm glad to hear that.
Absolutely.
Tell me, what questions should I ask you that maybe I didn't?
I think you hit on pretty much everything. The only thing we didn't cover was who was going to win the national championship, and I think that's going to be us. But outside of that,
Will you be going to the game?
I wish. Unfortunately, I am, as usual, working during that week, so I can't go.
All right. Well, Brent, it was a pleasure to sit down and talk with you, and I think that Humana is just so fortunate to have you coming on board, and I think you're going to continue to do interesting and amazing things in medicine, because it's so what you live and breathe is really what I'm hearing you say.
Well, thank you for saying that. It's great being here.
We will really be watching you in your career, and we're so proud to have had you and have you currently as a student getting their MBA with Clemson.
Thank you again.
Okay, thank you.
Absolutely.